Teenage supermodel. Presented with double vision, sudden aggressive behavior, cataplexy.
You had me a teenage supermodel. Wow. You should be a model.
Now we know what it takes for House to seize patients at the start of the episode before they're about to lose all their fingers and walk out of the hospital. Very excited to be reacting to House MD Season 2, Episode 13, Skin Deep. On this channel, we are reacting to all 177 House videos. This will be Episode 60. If I can't get the diagnosis before House, then I have to have 2 tablespoons of the least palatable condiment, like goodbye vinegar. I'm sure no one wants to see me suffer, so let's hope I get the diagnosis. No time to waste.
I think I'm gonna puke.
Not on this dress.
One of the girls said Madonna's in the front row.
The doctor gave me these for anxiety. Cheer up.
Are you okay?
Whoa! Did you see that slap and punch? She just put the E in WWE. The tablet that he just gave her could have been a couple of things. One is a sedative like Valium or Ativan. Considering the change in behavior and collapse, I'd say that one is more likely. The other option is a drug called propranolol, which is very interesting. It basically chills out your fight or flight response so that you're not affected by anxiety as much. Word on the grapevine during medical school was that some people used to take them before practical exams to make sure they performed their best. In golf, beta blockers like propranolol have been used as performance enhancing drugs as the margins are so small. Some golfers have to time their shot based on their heartbeat. But she wasn't feeling well even before the drug as she had pretty severe nausea. We also know models like this don't have the best nutrition, if any, so let's get more clues.
Teenage supermodel. Presented with double vision, sudden aggressive behavior, cataplexy.
You had me a teenage supermodel. Wow. You should be a model.
Now we know what it takes for House to seize patients at the start of the episode before they're about to lose all their fingers and walk out of the hospital. Also, we have some new symptoms: double vision, cataplexy. We already knew about the sudden aggressive behavior. The most specific and interesting of that list, though, is cataplexy. So what is it? It's when someone gets a sudden muscle weakness, usually triggered by intense emotion. That could be laughing, getting surprised, or clotheslining your fellow modeless straight into Madonna's lap. Cataplexy can be the first sign of narcolepsy where people suddenly fall asleep, so maybe this could be where that's headed. Speaking of sleep disorders, one of my colleagues went to go speak to a patient while he was a medical student of just 19 years old. He went to the patient's room and started asking questions, then immediately fell asleep. The patient was so kind, bless her, that she actually left him in the chair, and it wasn't until the nurses walked past and saw him in his chair that they realized he had snoozed for the last 45 minutes. Needless to say, he got a formal warning from the university. Craziness. Intrigued to know what's going on here though. I feel like her being a model must be related somehow. Maybe she's using a toxic cosmetic made from plutonium, or a weight loss supplement made from scorpion venom and snake blood. Let's see.
How long have you had the sweats?
Couple of days. My stomach's been bothering me, and I've been feeling a little nauseous.
Since when do you voluntarily go see patients?
You've seen her?
She's 15.
Seems like it's not just the patient getting hot under the collar. It would actually be very amusing if our beautiful female model was actually male. There is a condition called androgen insensitivity syndrome where someone is born with an X and Y chromosome but their body doesn't respond to testosterone. There was a famous runway supermodel recently called Hannah Odiele, I think she's Belgian, who came out with this exact same condition that would make her intersex, and there are more people with that than you think. 1.7% of the world's population are intersex. That's as many people as as have red hair. Many people keep this private though. There is no treatment for the underlying condition, but the testicles can become a cancer risk and could be triggering her symptoms. I'm gonna go with that as my first diagnostic guess, as the story would just be too good.
Hold her up as the sexual ideal. The law says we can't touch her for 3 more years. How hypocritical is that?
Labs show Valium and heroin in her urine.
She's never menstruated. Sounds like a symptom of drug addiction to me.
You're losing me, House. You're losing me. I know what he said sounds creepier than a clown in your loft, but it could also be interpreted in a different way. We shouldn't have 15-year-olds held up as the physical ideal on fashion covers. Moving swiftly on, the heroin thing is interesting, but what's even more interesting is she has never had a period. You know what other condition takes away your periods? Androgen insensitivity syndrome. I fixated on a diagnosis way too early before though. So let's open our minds to other options that fit the story. She could have an eating disorder, drug addiction, some kind of thyroid problem, or androgen insensitivity syndrome. It just fits so well. When I see a beautiful diagnosis, I'm like a moth to a flame. What can I do?
Some girls don't start till they're mid to late teens.
Evidence to the contrary. The rounded hips, perfectly sculpted, bountiful breasts.
Implants.
Ah, the age-old debate, how to tell if breasts are made by Mother Nature or Johnson & Johnson. First, you have what's called the fall line. When a woman lays down, natural breasts fall slightly to either side. Implants are likely to stick up straight, especially if they're too large. The borderline is quite important as well. Unless you have a very strong push-up bra, natural breasts don't have a defined border around all the edges. If looking directly at the left breast, there should be a border visible from around 4 to 8 o'clock. When looking from the side, natural breasts have more volume at the bottom thanks to gravity as well. Implants look full from top to bottom. My last point is on the pointers. Nipples should point straight ahead or slightly up. If an implant is too big, then the nipples can tip downward. There you have it. Although I'd prefer if you don't use your newfound analysis skills on anyone less than 18. So question for you smart people, what percentage of women have breast implants? Answer down below.
2 clinic hours says that those love apples are handcrafted by God.
You're wrong.
We chalk this up to drugs. We could be releasing her with juvenile MS or Parkinson's.
Detox
or...
her. Put her in a coma. Pump her full of Naltrexone. Cut the 4 weeks to 1 night.
How do they even know she's addicted to heroin enough to even need a detox? Yes, it came back on the tox screen, but that could have been from a small dose. Being physically dependent and trying a drug are two very different things. Also, it takes a long time for the body to come off an opioid addiction like heroin because all the receptors need to change back to their normal levels. You see, opioid drugs like heroin, oxycodone, or even codeine act on opioid receptors, which are important even for non-drug takers. That's because when these receptors are activated, then they can work by inhibiting other neurons or neurotransmitter release. So imagine that all of this downregulation because this drug flooding your receptors is there for months and boom, it's suddenly gone. What will happen to those inhibited neurons? Their activity is gonna jump up faster than a flea on a frog. So House wants to skip straight to the end by giving something called Naltrexone, which basically just displaces the drug from all those opioid receptors. That won't give the time for the body to adjust the receptors to their natural set point, so the natural opioids within your body that we call endogenous opioids can take over. So as soon as the Naltrexone wears off, she would be in withdrawal again, except she won't because she wasn't in withdrawal anyways. Signs of opioid withdrawal are things like dilated pupils, vomiting, high heart rate, sleeplessness, or watery eyes, none of which she has, although she may get watery eyes from crying if House tries to flirt with her again.
Pretty stupid thing to do, huh?
Getting hooked on drugs? Yeah, not the best move you've ever made. You son of a bitch! You killed her!
He's not dead.
What's the big deal, Dad? She's not dead now. That was so 10 minutes ago. I'm surprised House didn't take this as a sign that it wasn't the heroin that caused this. Naltrexone in the real world can be given to people who aren't currently dependent on opioids. They're not giving a normal dose though. They're infusing so much of it that even if her great-grandchildren took heroin, they wouldn't feel a thing. Although she may not be able to have great-grandchildren if she has androgen insensitivity syndrome. So with that much Naltrexone and no opioids to balance it out, then of course her heart's gonna stop. Usually in a situation like this, we would give something to replace the opioid like a buprenorphine patch and slowly bring it down. Sometimes it feels like House is playing a little game of death chicken with his patients. How close to meeting Jesus can I get them before we pull them back?
I haven't slept in weeks because my teeth hurt.
Poor you. When'd she do?
How'd you know she was...
Because I'm doing her. You're suffering from sympathetic pregnancy.
It's all in my head?
Nope. It's all in your hormones.
Oh, we haven't had a house clinic scene in a while. Sympathetic pregnancy is also called Couvard syndrome. It shows that men living with a pregnant female will have shifts in their prolactin, testosterone, estrogen, and cortisol levels. Brain scans show changes in the structures as well, with the fear and aggression centers doubling in size over the course of the pregnancy. But this syndrome is more than just hormonal or brain changes that can happen all the time with any partner. The man feels morning sickness, stomach cramps, back pain, and headaches. Some people do think it's a type of anxiety, and the good news is that it disappears as soon as the baby's born, because nothing cures anxiety like childbirth.
I got the cute doctor. Are you mad at me, Daddy? I got the cute doctor. Are you mad at me, Daddy?
Anterograde amnesia, short-term memory loss.
Oh, new symptom, amnesia. It seems like she's struggling to form new memories but has the old ones as she remembers who her dad is. That's anterograde amnesia because antero comes from anterior, which means front, like not being able to form memories in the time in front of you. Retrograde amnesia, on the other hand, means you lose memories before the trigger event. We're making an assumption though when we name these words that the future is in front of you and the past is behind you. Not all cultures share that belief though. The Aymara tribe in South America believe that the past is in front of you and the future behind. That's because you can see the past and it's already clear to you what happened, like what's in front of you. The future, on the other hand, is unknown to us, just like what's behind our backs.
Where's Dr. House?
What's the problem? Fine. You can wait. I am going to give you Dr. House's personal pager number.
Whoa, there you have it. Pregnancy is contagious, except the only thing he's going to be giving birth to, you wouldn't want to wrap in a blanket. So the hormones responsible for this breast growth would be estrogen and prolactin. These can change in sympathetic pregnancy and do get better after pregnancy, but they are quite swollen. The condition is called gynecomastia, and there are tons of other conditions in males as well, like obesity, liver dysfunction, alcohol abuse, low testosterone, high thyroid hormones, testicular tumors, or kidney failure could also cause it as well. If it doesn't go away on its own, then it will need surgery to be removed.
Are you doing your daughter? What? You should probably talk privately, huh? So, what did you do to her? Those perfect, perky, all-natural breasts.
That is my daughter you're talking about.
No, that's your daughter you were talking about.
I'm her manager. I have to promote her.
Are you gonna admit that you slept with your daughter, or are you just gonna let her die?
One time.
What? No way. We're all gonna need a long shower and a therapist after this one. I know this seems crazy and dramatized, but 73% of perpetrators of abuse are by a non-stranger. Almost 10% are from a relative. No wonder she started heroin. So many people live in a home that they no longer feel safe in. I spoke recently to a 23-year-old female with a 3-year-old daughter who were living upstairs in a social housing flat. The mother had previously been a victim of domestic violence, and this was her emergency accommodation. The thing is that the ceiling was incredibly thin and the neighbors downstairs could hear whenever she or her daughter even talked louder than a tiptoe. They then bang on the ceiling, telling them to essentially shut up. She didn't let her daughter play or run or make any noise out of fear of being attacked by her neighbor. I can't think of anything worse than feeling like a prisoner in your own home. I really hope the diagnosis here is androgen insensitivity syndrome now, because that meant the dad slept with a biological male. What does this abuse mean for her medical condition though? Let's find out.
PTSD. He did her.
Elevated proteins in her CSF.
Daddy didn't do this to her.
If you're too distracted to deal with this because your leg hurts, then
Yeah, I'm distracted. I'm all hung up on this 15-year-old patient who's cataplectic, rapidly losing control of her body.
Oh, this is getting spicy. House wants his abusive father to stay with his daughter here so he has enough time to find out any other critical bits of info he may have. Now, the team said the patient had elevated proteins in her CSF, so what does that mean? It means that there is something organic causing this, like bacterial or fungal meningitis, neurosyphilis, but she's not quite old enough for that, or could be likely an autoimmune condition. The team keep talking about MS, but that would be way too obvious, and they couldn't do an MRI earlier, which tells me that whatever it is, an MRI would be critical in finding it. I still think that she has a tumor in her testicle with a paraneoplastic autoimmune non-MS demyelination. It just works so perfectly. Now, if you think this channel works perfectly for you, then check out the channel membership. You get priority access to new videos, access to exclusive polls, and to suggest another series and episode for me to react to. The first 30 members have a chance to win a 1-hour one-on-one tutor session with me on a topic of your choice. We actually lost a few members recently and currently have 21 members with only 9 spots left. I'm not sure why the members who left have gone, but I'm working hard to try and get even more videos done early to make it worth it, and I'm working tirelessly to try and keep improving the content for you to make it worth your while. So if you're interested and want to support me in this process, then press join below to secure your spot.
Now, if you're not too distracted, go take out a piece of her brain, stick it under a microscope.
Brain biopsy shows no white matter disease.
What if everything we're seeing is just smoke signals? Tumor.
Whoa, 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 wait a minute. How have they not done an MRI because of her shaking too much, but have been able to take a chunk of her oversized walnut? I say that because taking a biopsy blind is like bobbing for apples in a piranha pool. You'll probably hit what you want eventually, but whether you still have a tongue by that point is questionable. So yes, their chunk of brain looked clean, but what about all the other chunks in there? Now, what would make me suspicious for cancer in real life is if a patient comes with excessive tiredness with no other cause, iron deficiency anemia in a male or a postmenopausal female, unexplained weight loss of more than 5% of your body weight over the last 6 months. Any of those, then my alarm bells would be ringing. The most common sources in a woman would be breast, bowel, ovarian, or lung. We'd be doing an abdominal examination, maybe a rectal exam if there's been bleeding. We'd check blood counts, ovarian cancer tumor markers, stool for blood while getting a chest x-ray. That might give us where the potential source is so we can target our approach more. I have a sneaky suspicion House's team approach may be a little more aggressive. Let's find out.
She could also have paraneoplastic syndrome, which would be causing antibodies to attack her brain. It's perfect. But the twitching should stop right about now. The IVIG vacuums her blood, neutralizes the stuff that's making her twitch.
Okay, some of you guys get a bit confused when I get excited about things like this, and so let me explain. There are so many levels with which you can look at a person. Atoms of carbon, oxygen, and hydrogen, with some holding their ground solid and others whizzing around and colliding in a beautiful gaseous chaos. Molecules and membranes with subcellular machinery and small factories building machines in themselves that repair DNA or fight infection. Cells themselves that organize themselves together into tissues to filter blood or emulsify fats. At each of these levels, there are worlds within worlds within worlds working harmoniously together. And to become a doctor, to get through the hordes of information you need to learn to get through med school exams, we have to find it fascinating. And that's why I want to share my knowledge of these worlds with you, open their doors for you too. Whether you believe in creation or evolution, the human body is pretty remarkable.
I need a shot of morphine in my spine. I can't ask Wilson because he figures it's all in my head. But what about this? Is this in my head? I could swear I remember a thigh muscle being here.
I'll get a syringe.
I've seen so many patients with chronic pain, as or more severe than House, and none of them can work. Dealing with that discomfort daily takes its toll on every part of your life. That being said though, an injection of morphine directly into the spine is pretty extreme for House's case. How would we escalate this in the real world? First, we need to figure out the type of pain that it is. Most likely it'll be neuropathic, which means that the nerves in the area are overfiring and need to be calmed down. There are only 4 drugs that can help with that: amitriptyline, pregabalin, gabapentin, and duloxetine. If we thought that instead of neuropathic it could be direct inflammation to the muscle or fat, then we would escalate on the pain ladder from Vicodin. You see, Vicodin is a combo of a drug called hydrocodone and acetaminophen. It's only medium strength on the opioid ladder pain scale, so you could technically ramp it up to oral morphine, buprenorphine patches, or oxycodone, at least temporarily, to try and get things under control, as they are in the higher level of the pain ladder. Then you could step it down afterwards. A pain clinic could potentially also do a regional block of the nerves with anesthetic that lasts a few months to give more long-term relief without doping him up. I find it insane how he can keep working like this.
Gotta be cancer.
It's not cancer.
Knew the twins were real. Chase owes me.
You don't have to be afraid of him. They can protect you.
I seduced him. I wanted to have sex with him. By sleeping with him, now he lets me do whatever I want.
This episode has more twists and turns than a worm on a helicopter blade. I know what the writers are doing with this, try and blur the lines between right and wrong, but doesn't matter how drunk he got or how much she switched on the charm. As a dad, you need to be more than one french fry short of a happy meal to be able to make a pass at your own daughter and not have to vomit yourself to sleep. Interestingly, when Wilson was looking at the scan results, he mentioned her ovaries are very small. I wonder if that's a clue. The suspense is killing me. Question for you smart people: what is bigger, an ovary or a testicle? Answers down below.
George, get your butt over here!
How did you get my patient number? I give you an epidural. You won't be able to feel when to push. Got yourself the perfect man. A woman.
What are we looking for?
That.
But those are...
Yep. He has cancer on his left testicle.
No way! Holy... Oh my... Goodbye, vinegar. This has to be my best diagnostic guess so far. Wow, I am taking that. Androgen insensitivity syndrome is exceptionally rare. Only around 2 in 100,000 males are born with it. It's caused by a mutation in the coding sequences of testosterone receptors. It doesn't affect females because it's X-linked recessive, and females have an extra copy of the X chromosome. They can take away her twitching, cataplexy, and memory disturbance by taking out the tumor on her testicle, but there's no way of fixing the underlying condition. She wouldn't be able to have children either. What an insane diagnosis. This has to be one of my favorite episodes in the series.
Your testes never descended because you're immune to testosterone.
This is obviously a joke.
No, a joke would be me calling you a homo.
No, you're wrong. I'm a girl. Look at me. How could you say I'm not a girl?
Put your clothes back on. I'm gonna cut your balls off.
I gave you a placebo.
You just can't show me.
This episode blew me away. Don't worry, my clothes are staying on though. I know the fact Cuddy gave House a placebo makes it seem like his pain is all in his head, but that isn't quite the case. So much of how we perceive pain is based on how we feel, and if a medicine gives us hope and optimism, then it can close the pain gate. There have been even studies where you put a patient with severe asthma under anesthetic and pretend to do a procedure when you've done nothing, and their self-reported symptom severity reduces by 33%. The mind is a powerful thing, but so are the testicles apparently. This has to be one of the best House episodes in the whole series. 9 out of 10 entertainment, 8.5 out of 10 accuracy, 9.5 out of 10 diagnosis. This episode makes way more sense when you watch the previous one where House wants to get even with an old enemy. Here